early feeding and nutrition plays a very important role in childhood and even up to adulthood. It has certain far-reaching effects. So diseases like type 2 diabetes, hypertension, obesity, and the metabolic syndrome have their roots in nutrition as far back as childhood. And so it's important for us to establish good nutritional practices in the neonatal period throughout childhood and adolescence onto adulthood as well. And the healthy feeding practices require a multidisciplinary approach. So you have healthcare providers, physicians, nursing staff, nutritionists. In some countries, you have lactation consultants who help a mother breastfeed successfully. So look at breastfeeding. So breastfeeding should be initiated soon after birth, unless there are medical contraindications. So for example, if a woman has lost a lot of blood during the delivery and she's very weak, her blood pressure is low, you are more interested in resuscitating her than putting the infant to breast. So in the absence of any contraindications, as soon as the baby is delivered, the baby should be put to the breast. And we know that the WHO, as well as the American Academy of Pediatrics, advocates strongly for breastfeeding. And so the success of breastfeeding depends on a lot of factors. For example, support for the breastfeeding mother from having the opportunity to have a stress-free environment. And the recommendation is for a minimum of 4 months. It used to be exclusive 6 months, but now minimum of 4 months, and then preferably for 6 months. So at least if you can't do the exclusive for 6 months, at least 4 months is acceptable. So there are what we call baby-friendly hospital initiatives, which is designed by WHO and UNICEF to promote healthy breastfeeding. And there are hospital initiatives. And if you go to some hospitals, you see these things clearly stated on the walls. So the hospital is to provide all pregnant women with information and counseling on breastfeeding. Then they are supposed to document the desire to breastfeed in the medical records of the mother, and also document the method of feeding in the infant's records. So that's a weighing card. And they are supposed to, the hospital is supposed to initiate breastfeeding within 1 hour of birth, and then continue the skin-to-skin contact at other times and encourage rooming in. Rooming in is a practice where the mother is in the same room with the baby after delivery. In some places, you have a nursery where the babies are kept, and then the mother is also kept in a different place. But the WHO, UNICEF hospital initiatives for successful breastfeeding encourages rooming in so that the mother is in the same room with the baby. Then assess breastfeeding, that is each shift, during each shift, each nurse, each midwife assesses the breastfeeding of the mother and encourages breastfeeding and continues to teach on each shift. And these are some of the tips that are encouraged to be taught to the mothers. So proper positioning and latching on, nutritive sucking and swallowing, milk production and release, frequency and feeding cues. So you teach the mother some of the things that should tell them that, okay, this baby needs to be fed. Then also expression of breast milk if needed. Assessment of the infant's nutritional status. Typically, we use the weight of the infant to assess whether the infant is feeding well or not. And then also tell them when to seek help from the clinician. So maybe if the baby is lethargic, the baby is not gaining weight, baby is jaundiced, these are clear indications of when to seek help from the clinician. So additionally, in places where we have a lactation consultant, there's a need to refer to a lactation consultant if there are any concerns. And ideally, the infant should go to the breast at least 8 to 12 times per day and night. So this amounts to about every 2 hours or every 3 hours. Then also avoid time limits on the breast. So don't say that you are in a hurry or whatever. Offer each breast at each feeding session and then continue with the next breast. It's also important not to give sterile water, glucose, or formula unless it is indicated. Maybe the baby is in hypoglycemia and you want to feed with formula. Otherwise, we should always insist on breastfeeding. If you want to give formula, then we encourage cup feeding or syringe feeding, not with the bottle, because we don't want the baby to get used to feeding from the feeding bottle and so refuse to suckle from the breast. Then for the same reason, avoiding the use of pacifiers in the nursery are medications that prevent adequate breastfeeding. So to encourage us to breastfeed or to teach breastfeeding, we need to know some of the benefits of human milk. So human milk contains secretory IgA, which is has an anti-infective action. Then it also contains lactoferrin, which helps with immunomodulation, iron chelation. That is when there's too much iron in the system, this lactoferrin will bind to the iron. Then it also has an antimicrobial action. It's anti-adhesive, and it helps with intestinal growth. Now we also have K-casein, which is an anti-adhesive. Anti-adhesive means that it prevents the attachment of harmful bacteria to the intestinal wall, and then also promotes the growth of bacterial flora, which are beneficial bacteria in the gut. Then we have human milk oligosaccharides, which prevent attachment of bacteria. Then we also have cytokines in the breast milk, which are anti-inflammatory. Remember in pathology, we talked about cytokines. We have growth factors, we have nerve growth factors, we have enzymes, we have nucleotides, and all these enrich the breast milk to give benefits to the human infant. Now, because of all these things that breast milk contains, it says it has a protective effect over the baby. Now, these protective effects are divided into two. We have acute disorders, and then we have chronic disorders. So the acute disorders are the ones that they are short-lived. So something like diarrhea, for example, you would hardly hear of a breastfed baby who has diarrhea. They have frequent stools, but it's not diarrhea, like the type that needs resuscitation with IV fluid or antibiotics and so on. You would not find a breastfed baby having that. Then it's also protective against otitis media. So typically for a baby who is exclusively breastfed, you wouldn't find that that baby has an ear infection before 6 months of age. Then it also protects them from necrotizing enterocolitis, protects them from septicemia, which is infection or sepsis, and then protects them from infant botulism. So for the chronic disorders or the long-term protective disorders, breastfeeding protects infants against diabetes mellitus, celiac and Crohn's disease, and then childhood cancers, typically lymphomas and leukemias. Oh, my screen sharing is paused. What does that mean? Nick, resume share.
Okay.
I'm fine. I'm fine.
You figured it out.
Yeah, I figured it out. So conditions for which human milk has a protective effect. So recurrent otitis media, allergy. So we find that a lot of the time, babies who are given artificial formula, they tend to develop allergies later in life. And then they also become obese and overweight because the formula has higher protein and fat compared to the human milk. And human breast milk also protects against infant mortality and hospitalization. So the infant mortality, usually it's from recurrent infection, especially diarrhea. And the diarrhea that the infants get, it's from either the water is not clean, or the mixing is not correct, or the utensils that are used in the mixing are not clean. So maybe the feeding bottle is not well washed, the teat has some bacteria hanging in there, which leads to infection. Okay. But even though breast milk is beneficial, there are some contraindications. And some of these are absolute and some are relative. So in the US, HIV and HTLV infection, that is human T lymphocyte virus infection, is contraindicated in the US. If you have HIV, you are not advised to breastfeed. So if you have HIV, the baby is delivered by cesarean section, no vaginal delivery, and you take your antiretroviral drugs during the pregnancy, and then you don't breastfeed. However, in our setting, the risk of the baby getting diarrhea from your formula feeding compared to the risk of HIV infection from the breastfeeding, the risk of the HIV is less. So we would rather the mothers breastfeed rather than not to breastfeed. Now, we do not want to encourage mixed feeding. Why? Because when you give both artificial milk and breast milk, the breast milk contains the HIV virus. Fair enough. Now, the artificial milk is cow's milk. Sometimes it can cause an allergy in the intestine, and the allergy will lead to inflammation of the intestinal mucosa. Now, once this inflammation occurs, and then you breastfeed, introducing the virus. Once there's inflammation, the virus is better able to penetrate the intestinal wall and cause the infection. And so we would rather you stick to one. If you're doing formula, you are doing formula. If you're breastfeeding, you are breastfeeding. And so when you want to counsel mother and find out what option she wants to use, make sure that she's able to support it. If she wants to breastfeed, fair enough. Breastfeeding is cheap, it's not expensive, there is no nothing required to breastfeed. If she wants to use formula, you have to be sure that she can sustain it. She is her work such that it's her income such that she'll be able to sustain it, bearing in mind that as the infant grows, their consumption would increase, and all those factors. Socially, will she be able to stand the societal pressure that comes with not breastfeeding? So let's say you're sitting in a church and your baby is crying. You decided not to breastfeed and you don't have the formula with you. Will you be okay with everybody shouting at you, "Mami manunufwe, mami manunufwe," rather than just breastfeeding and forgetting about the formula? So these are all important things that we need to talk to mothers about when they have HIV during the pregnancy, so that they decide on what they want to. I didn't say you should bring, why are you bringing your church clothes for what? Okay, so put them in my laundry basket. I'm having a class, please don't disturb. All right, so tuberculosis is also, if you have tuberculosis, it's contraindicated until you've completed 2 weeks of therapy. At that time, we are sure that when you cough, you will not infect the baby with the bacilli. Then also varicella zoster, that's chickenpox. You can either give the infants the immune globulin, or you make sure that the mother doesn't come in direct contact with the baby. So in that case, for example, the mother can express the breast milk and somebody can feed the baby with it. Then CMV infection, herpes simplex infection. If you have herpes simplex of the breast, you don't want to breastfeed because then you directly infect the baby with it. Now, hepatitis B infection, usually, if you know during the pregnancy that the mother has hepatitis B, you would let them get hepatitis B immunoglobulin. And this is given to the baby within 72 hours of birth. However, you shouldn't delay breastfeeding because you're waiting for the hepatitis B immunoglobulin. Then Hep C infection, breastfeeding is not contraindicated. Now, alcohol. So you can take alcohol during breastfeeding, but you need to limit it to 2 cans of beer or 2 glasses of wine or 2 ounces of liquor. Cigarette smoking is not a contraindication, but we discourage mothers from smoking during breastfeeding. And then definitely if you are on any kind of cancer chemotherapy or radiopharmaceutical, you would not breastfeed because the chemotherapy can be transmitted through the breast milk to the baby. So let's look at the breastfeeding, patterns of milk supply. So on day 1, some breast milk will come. So if you squeeze the breast, you get like maybe 5 mils or less. Then from day 2 to 4, that's when the milk production increases. So during this time, if you continue breastfeeding the baby, you realize that the milk production increases with time. By day 5, the breasts are full, and then when you are feeding on one breast, the other breast starts to leak. And from day 6 onwards, after the baby feeds, the breast feel empty. So these patterns are important for us to understand so that when we are counseling the mother, maybe the breast milk is not coming, you encourage her further that it's actually going to start coming. And so she should just keep on giving the breast to the baby. There are some common problems which discourage mothers from breastfeeding. The first is nipple pain, and usually this comes from poor positioning of the baby. When the baby is positioned, the whole breast, the whole areola should enter the mouth so that the nipple will be in the middle. When this happens and the baby sucks, the pressure will not be on the nipple, but will rather be on the areola, and there'll be no pain. However, if the baby is not well positioned and it's only the nipple that's in the baby's mouth, then when the baby sucks and creates a vacuum, this puts pressure on the nipple and leads to the nipple pain. You can also have engorgement of the breast as a result of a lot of breast milk in the breast and the baby not feeding fast enough, so the breast become engorged with breast milk. So for this, what you need to do is to use a breast pump to express so that there will be some relief. Now, when the engorgement goes on for a long time, the milk can become infected, and then this leads to mastitis, that's inflammation of the breast. This needs to be treated with antibiotics, and sometimes when there's an abscess, you need to do an incision and drainage to let out the pus. Milk leakage is also a common problem that mothers face. So when you are breastfeeding and let's say it's getting to time for the baby to usually be breastfed. If let's say you breastfeed every 2 hours or every 3 hours, as it's approaching the time, you realize that the breast starts feeling full and then they start to leak breast milk, like breast milk will come out from the nipple. And so a way to go about this is to have breast milk pads, which are put inside the bra and soak the breast milk so that it doesn't soil the shirt or the blouse of the mother. Sometimes the babies don't take enough milk, and so with the inadequate milk intake, the breast becomes engorged. So this can be addressed by expressing the breast milk. Babies can also develop jaundice, and typically the jaundice they develop during breastfeeding is called breast milk jaundice. And this is when the breast milk contains enzymes which deconjugate the conjugated bilirubin, leading to jaundice. Usually, if the baby is well, you can continue breastfeeding and then it will clear with time. So let's look at expressing breast milk, because in our setting, a lot of mothers are working and they express the breast milk to be stored to be fed to the babies later. And one thing that is important is that there's good hand hygiene should be emphasized. And there are various types of breast pump. We have the electric pumps, we have the manual ones. The electric pumps are usually more efficient and they are faster. Now, when you express the breast milk, you put them in breast milk containers. So either you have containers with airtight lids, or you have Ziploc bags with that you put the breast milk in. So once you have the breast milk, you've expressed that you've put this in these containers, you can store it. You can store it at room temperature up to 24 hours, meaning that if you store it at room temperature, it's not in the fridge, it should be consumed within 24 hours. Otherwise, you have to throw them away. Then the breast milk can be refrigerated up to 48 hours. If the breast milk is frozen, it can be stored for up to 6 months. And when you take the milk out of the freezer and you want to use it, you can rapidly thaw it by holding it under running water or sitting it in a bowl of warm water. When it thaws, then you rewarm it. You keep warming it until the temperature is such that the baby can take it. So to check the temperature, you pour some over the back of your hand to check whether the temperature is okay or warm enough for the baby. Milk should never be microwaved, because when you microwave the breast milk, when you microwave the breast milk, you kill the bacteria and the microorganisms, not the microorganisms, the oligosaccharides, the proteins, the helpful things that are in the breast milk, which are important for the growth of the baby, the cytokines and all that, you deactivate them. And then the other reason is that when you microwave food, you realize that there's uneven heating of the food. So sometimes the food is warm, sometimes some portions are cold. And so when the milk hasn't heated, it's unevenly heated, if you feed the baby, you can have burns because some parts will be very hot whilst others will be cool. And when you hold it, you feel as if, oh, it's okay, but you could actually have boiling points within the milk. Okay, so when you breastfeed a baby, the rate of weight gain is different from that of a formula-fed infant. The weight is natural and follows the growth curve. And sometimes when you are bottle feeding is different from that of a formula-fed infant. The weight is given and follows. Okay. So sometimes we give formula because maybe the mother is not breastfeeding well, she has to go to work, so many issues. But whatever it is, infant formula is also safe and can be used for the first 4 to 6 months of life. We have infant formula in ready-to-feed forms like concentrated liquid. We also have it in powder form. We have it in ready-to-feed form. That is when you take it, you feed it to the baby right away. And they usually give 20 kilocalories per 30 mils, which is about 67 kilocalories. Now, there are instructions on each of them, and so you need to follow the instructions to the letter. What happens is that each formula has a scoop. So when you use the scoop, you take a level scoop, and then 1 scoop goes to 30 mils of water. You mix it in lukewarm water, and then it's ready to be fed. So you prepare it in multiples of 30 mils. So for example, if you are going to use 2 scoops, then you have to take 60 mils of water, 3 scoops, 90 mils of water, and so on. It's also important to know that the powder preparation is not sterile. So once you open it, now you have exposed it to bacteria. And so you need to finish it up within a month. And the water that is used should be boiled or sterilized. And you should teach parents to use proper hand washing. So you wash your hands very well before you prepare the formula. Also, once you open it, you have to store it in a, make sure that you put the plastic wrap over it with the aluminum foil inside. You should store it in a cool, dry place, and you should make sure that you consume it or the baby consumes it within 2 hours of preparation. Don't leave it sitting there, sitting there, sitting there. And of course, you shouldn't also heat it in the microwave because of the same problem of uneven heating. So the formula feeding is the same as a breastfeeding. You feed on demand, and you would usually realize that the baby would gain between 25 to 30 grams per day for the first 3 months. Then between 3 months and 6 months, the weight gain would gradually go down. So some of the common problems that are encountered during formula feeding, you don't give water. A lot of the time, mothers say that, oh, I'm giving formula, so I'm adding water. No, you don't. You're not supposed to add water. And then babies vomit a lot, which is normal. And they might have what we call spit ups. You give them the formula and then they spit some out. That's also normal. If the baby is gaining weight nicely and they are fine, there's no need to change the formula. The baby can also develop allergy to the formula. So when it happens, then you would have to switch to something else. So weaning. So usually the weaning is when you introduce other foods. And this usually starts between 4 and 6 months of age. But once you are introducing other foods, you continue breastfeeding or formula feeding. Usually you can do that until like 12 months of age. And then you can introduce formula if you've been exclusively breastfeeding. But you cannot give cow's milk. Cow's milk is the normal milk that we take as adults. So ideal milk, pig milk, and so on. You can't give that until the baby is 12 months of age. Between 12 months and 24 months, you can give follow-on formula. So for most of the companies, they have, let's say if we are using NAN, for example, we have NAN 1, NAN 2, NAN 3. NAN 3 is usually used between 12 months and 24 months. That's the follow-up formula. So when you want to start weaning, what advice do you give the mother? You introduce the foods one at a time and give the food for 3 to 5 days to observe for tolerance, rashes, any signs of allergies. You choose foods which are rich in nutrients, which can meet the baby's energy needs, especially protein, iron, and zinc. These are the key nutrients. And when you give the baby a food, you offer it 8 to 10 times. You don't stop because you gave once, twice, and the baby refused it, so you think that is it. No, you have to offer it at least 8 to 10 times before, if the baby keeps refusing, you're sure that's okay. Baby doesn't like this particular food. Then ensure that the baby is taking adequate calcium. So this is why you have to continue breastfeeding, or you give formula milk during the weaning period. You shouldn't give fruit juices to the baby during the weaning period. So the fruit juices, whether artificial or natural, you should try and limit it. And make sure that certain things that can be a choking hazard are avoided in food. So for example, the food should be mashed. It shouldn't be solid, such that if the baby is taking it and they laugh, they can choke on the solid food. So avoid things like nuts in the food, like groundnuts. Avoid popcorn, avoid sausages, hot dogs, popcorn, yes. And then try and avoid adding salt or sugars to the food. I always say that, I always say that infants don't have a sweet tooth. We are the ones who introduce it. So if you keep your baby on porridge without sugar and just milk, they'll take it. And as time goes on, you realize that they are fine without the sugar. But then as they grow, we start with the fruit juices and the chocolates and the sweets, and then they become fixated on sugar, which is not very good. Okay, so that's feeding the infant. Are there any questions? Any questions?
No, doc.
Hello.
Okay, yeah. Anybody has any question?
I have.
It's raining, so everybody is sleepy. Eh?
I have.
Pastor, you have?
Yeah.
Okay.
Yeah, please go ahead.
I'm asking about the supplementary feeding, or is it complementary sort of? Is it wise to commence it around 2, 3 months because of mother not ready, mother working?
So I don't know what you mean. Is this supplementary or complementary? So complementary is the weaning, like the cocoa and the Cerelac and those things. That's complementary.
Yeah, so it will be supplementary rather.
To replace breast milk.
Yes.
Yes, so you can start supplementary feeding at any time that you feel the mother is not available and there's no breast milk. Hello? Hello?
Okay, I'll meet you. Also, making a lot of money. Any question?
Yeah, Doc. Today we were having this discussion, though this is not specifically to the child, but then we were like that nutrition contributes to breastfeeding. I mean, breast milk production.
Yes. Yes, so the mother's nutrition is very important. If she's not well nourished, her breast milk doesn't contain much. So for a mother who is poorly nourished, it's probably better to give formula since her breast milk is virtually has nothing in it.
Oh, okay. We said this today, the whole class, they were like, breast nutrition doesn't contribute to breast milk production.
It does.
We have
the raw materials are from the mother's body. Great. So the calories and the proteins and everything, vitamins that are present in the breast milk is derived from what the mother is taking.
Really?
Yeah.
Thank you very much.
All right. Any more questions?
Any more questions? Any more questions? We have like 3 minutes to go. Okay.
Doc. Hello, Doc.
Yeah.
The breast pad issue.
The
breast pad.
The breast pad, yes.
Yes. How often are they to use it?
Oh, so for example, if you are a working mother who you go to work and your breasts become engorged and they start leaking, then you should always have it with you inside the bra.
Yes. So is it
so
a single use
in 24
hours? Or...
Are you asking how often it should be changed?
Yeah, to be changed, some sort of.
So of course, let's say, so when you come back home from work, you should take it out and put in a new one. Or you can change it maybe every 6 hours or every 4 hours, depending on how it gets soaked. And of course, if it's soaked, you have to replace it and put another one there.
Okay, Doc.
Because when it stays for a long time, bacteria can also grow on it and then contaminate the area. Okay. And mothers should not forget that when they bring out the breast, they should clean it before they breastfeed the baby.
Okay, ma'am. Thank you very much, Doc.
All right.
Okay, we have less than a minute.
If a baby has an eye infection, breast milk can be used. No, that's not true. It is an infection. You need to give antibiotics to treat it. So this is something that we do in our society, but that's not true.
The breast meant for the baby alone. Hey, Aju.
No.
The breast milk for the baby alone, yes, it is.
No, ma'am. It's debatable.
It's not debatable. It's for the baby. When the baby finishes breastfeeding, the other owner can come back and take over.
So it means it's also for the man.
Well, if you want to take breast milk, yeah.